is Medicare anyway, and how does it work? What does it cover? And is Medicare actually insurance? Though these may seem like simple questions, the answers, of course, are more complex. However, you've come to the right place for Medicare information. Hi there, if we haven't met yet, I'm Danielle Kunkel-Roberts, co-founder here at Boomer Benefits and a member of the Forbes Finance Council. In this video, we'll define what Medicare is and explain how it's different from Medicaid. We'll also give you a brief explanation for the 4 parts of Medicare. Stay tuned to find out how you can sign up for our free 6-day Medicare email mini course, which comes with our new to Medicare checklist and a bonus worksheet to help you calculate your potential cost for Medicare. And don't forget to hit that subscribe button so that you'll always be notified when we release a new video about Medicare here on our YouTube channel. Let's define Medicare coverage. Medicare is a national United States health insurance program for people age 65 and older. It is also for people with certain disabilities, illnesses, or end-stage renal failure. The Medicare program's coverage is divided into various parts, and it's important to learn how these parts fit together. Part A is your hospital insurance, and this assists you with the cost of inpatient care and skilled nursing. It also helps with things like hospital and home healthcare services in the hospital. In general, you should think of the inpatient hospital benefit as Medicare coverage for room and board in the hospital. It covers the cost of a semi-private room and doctor and nurses that come to check on you. The cost of Part A for most people at age 65 is $0. This is because you've paid taxes toward it during your working years. If you don't automatically qualify for premium-free coverage, you can pay for Part A, although it will cost you a hefty premium. Medicare Part B is your outpatient medical coverage, and Part B covers essentially all of your other coverage that happens outside of inpatient hospital and skilled nursing. Without Part B, you would be uninsured for doctor visits, lab work, diagnostic testing. You would also not have Medicare coverage for preventive services, outpatient surgeries, ambulance, and emergency care. More importantly, Part B covers cancer therapy and kidney dialysis. These are really expensive and would cost you a fortune without supplemental coverage. The cost of Part B is set by Social Security, and it changes from year to year. Individuals in higher income brackets pay more than those in lower brackets. How much you will pay will be determined by your modified adjusted gross income that you report to the IRS. You can read more about the cost of Part B on our Medicare cost page on the Boomer Benefits website. Moving on to Part C. We define Part C as a Medicare Advantage program or private insurance that provides the same services as Parts A and B and usually includes Part D as well. The cost of Advantage plans vary by carrier, county of residence, and the plan selected. Now, to enroll in a Part C plan, you must first be enrolled in both Parts A and B. Even if you find a Part C plan with a very low premium, you will still pay for Part B. You must also live in the plan's service area. Once you enroll, your Medicare coverage will come from the Medicare Advantage plan itself and not from the government. Now, the reason you don't enroll in Part C at the Social Security office is that Part C is optional. Many people prefer to get their Medicare coverage from original Medicare and a traditional Medigap plan. These people do not want a Part C Advantage plan, so they simply don't enroll in one. It's your choice whether you wish to opt for one as opposed to just staying with your original Medicare A and B and enrolling in a Medigap plan. Check out our video here on YouTube about the pros and cons of Medicare Advantage plans. This will really help you understand the difference. Finally, Part D is the newest part of our national health insurance program. For half a century, there was no Medicare coverage for outpatient prescription medicines. But in 2006, our federal government rolled out Part D. Now, Part D covers outpatient retail drugs that you yourself pick up or order via mail order. You will choose an insurance carrier and enroll in their drug plan, and that's how you sign up for Part D. Most states have about 20 to 30 drug plans to choose from, and so the best way to determine which one is right for you is to have your Boomer Benefits agent run a Part D analysis using Medicare's prescription drug finder tool, which can be found at medicare.gov. Now, what's the difference between Medicare and Medicaid? This is a super common question that we get around here at Boomer Benefits. By definition, Medicare is a health insurance program for the elderly. Medicaid, on the other hand, is a financial and/or healthcare assistance plan for low-income individuals. Some people who have very low incomes have both Medicare and Medicaid. When they have both, Medicare is primary and Medicaid is secondary. Medicaid helps to pay for some of the expenses not covered by Medicare, such as deductibles and coinsurance. Depending on your level of Medicaid coverage, you can also qualify for assistance with your Part B premiums. Do you need help understanding what Medicare is and how it works? If so, don't hesitate to drop your questions in the comments below and we will answer. Don't forget to sign up for our 6-day Medicare email mini course so that you can get our free new to Medicare checklist with a bonus worksheet that will help you to determine your estimated cost for Medicare. Thanks for watching, and we'll see you in the next video.